Hello, everyone, and welcome to Heads Up, the weekly podcast of the National Headache Foundation. This is Dr. Lindsay Weitzel, migraine strategist, founder of the Facebook group Migraine Nation, and chronic daily migraine survivor. I'm here with Dr. Vincent Martin, MD. He's the director of the Headache and Facial Pain Center at the University of Cincinnati and the president of the National Headache Foundation. Hi, Dr. Martin. How are you?
Good. How are you?
Good. Thanks so much for being here today. So we have some awesome stuff planned today. So get ready. Today is part 3 of our 3-part series on refractory migraine. What is it? How do we get rid of it? Everyone wants to know this. So last time we discussed issues related to hormones and to metabolism. This time we are going to talk about some remaining possible causes and things that we can address that we didn't look into in the previous 2 episodes. So let's look at some problems that we can detect on blood tests and just some other remaining lifestyle issues. Let's start, Dr. Martin, let's define refractory migraine. Since I don't think that there really is a formal definition, let's talk about how we're defining it in this series.
Well, as you said before, there's no formal diagnostic criteria, but usually people fail 3 or more preventative therapies, and they usually have more than 15 days per month, and oftentimes of headache, and oftentimes they have near continuous headaches. So they're a very refractory group of patients.
Right. Okay, so you've been treating these types of patients for over 24 years now. So everyone wants to know your view on this, how you've helped people. So when someone comes to see you and they're refractory and they're miserable, what sort of blood test, because not everyone runs a blood test, what sort of blood tests do you order? What sort of diseases are you looking for?
Well, when you have somebody that's refractory, you got to kind of pull all the stops out.
Mm-hmm.
So looking for blood work can be an important thing. So you're looking for other kind of disorders like anemia, for example, and while some people may look very pale when they have anemia, sometimes it's not always readily obvious.
Mm-hmm.
So you have to be able to check that on blood work to really pick that disorder up.
Right.
And then there's other disorders too, like thyroid disease, either low thyroid, which is what we call hypothyroidism, or high thyroid, which is hyperthyroidism. And I've had patients with both of these disorders that have been picked up, and there weren't all the classic signs and symptoms of those disorders. And then there can be other things like other inflammatory conditions. So we check something called a SED rate, which can pick up like inflammation in your body. And there's a disorder called temporal arteritis, which in patients over 50 is where they have headaches, mostly in the temples, and it involves inflammation of one of the arteries in their head. And then there's other blood tests looking at electrolyte abnormalities. Like sometimes you'll pick up somebody's sodium being low, or their potassium being low, or their kidney function being a little bit off. So there's a variety of different things that you can pick up on blood tests. And frankly, many doctors don't check blood work in people with refractory migraine.
Okay, so let me just clarify, because I think a lot of people, if they went into a doctor and they're miserable with constant migraine, they're going to wonder, why on earth are you curious about my thyroid or my this or that? I think what we're trying to say is that if you are prone to migraine and one of these things is off, it could very likely trigger your migraines to be very bad. Is that what you're trying to make clear to people?
Think about the nervous system being hyperactive. With migraine. So it doesn't take much to trigger a migraine in that situation.
Okay. All right. So, so we talked about possibly thyroid issues that we could detect, electrolytes being off, anemia. There's all sorts of things that you could possibly look for in someone's blood if you hadn't found a previous reason for their refractory migraine. I'm curious because I see people post about this all the time on the internet, and I've had people come to me and ask. I think it comes across wrong. Sometimes when they go to their doctors, they feel like they went to their doctor for migraine and they were told they were overweight and they should just go lose weight. And they were like, what on earth does this have to do with my migraine? And it's annoying to them. It really comes across that. It might even depress them. Can we talk about what is the relationship between migraine and weight?
Well, the relationship is basically that that people who are being overweight is a risk factor for developing chronic migraine. There's an association. It doesn't mean necessarily there's cause and effect. But when I see someone that's overweight, there's two things I'm thinking of in particular, two diagnoses. One would be something called obstructive sleep apnea. As you get a little bit overweight, the tissue in the back of the throat starts to fall back when you go to sleep, and you'll snore. And then you're basically, you'll stop breathing, or you can stop breathing multiple times at night. And then oftentimes you'll wake up with a headache. It's called morning headache. Right. And that can happen in some people who are overweight. So when I see somebody who's overweight, it makes me think of that's one diagnosis I think of. The other diagnosis is something basically where the spinal fluid pressures increase. We know that patients that gain weight can have elevated levels of spinal fluid pressures. And if you want to go back and look at one of our past webcasts, we actually went through this. But in that situations, people's headaches are worse when they lean forward, worse when they cough down, bear down, or sneeze. They may be worse when they lie down, and the headaches may be worse when they wake up in the morning. So if that's happening, I'm thinking more of spinal fluid pressures. And then the third thing is, I do tell people to try to lose weight. So I'm not telling them that that's the cause of their refractory migraine, but losing weight can help both of those conditions I mentioned, and it also reduces inflammation in the body, which could trigger migraine. So I think that there is a rationale for trying to get people to lose weight, but if people assume that that's the total cause for their headaches, I think that's not correct.
Right. Okay. I definitely think that people need to understand that, and I think that we need to make sure that no one's sensitive in thinking that this is going to fix their migraine, or that their doctor sent them away thinking, hey, lose weight and you're going to be fine, because that's definitely not what we want people to think. So are there any behavioral things you recommend to people when you're definitely trying to tease out, these remaining things that could be the cause of their refractory migraine?
Yes, I mean, usually what I tell patients with refractory migraine is that only half of their improvement is myself and any medications that I give them. The rest of it is in behavioral issues and dealing with other life situations that could be triggering headache. So if you have a very stressful life and all these things are going on in your life and you're not dealing with them very well, that's going to be promoting headaches. So you're going to need to address those social issues and maybe learn relaxation, biofeedback, and other measures to try to deal with that. If you probably should start to exercise. It's not been proven conclusively, but there are some studies that suggest that getting regular exercise 3 or 4 days per week can decrease the frequency of headaches in patients with migraine. Other things would be behavioral things like going to sleep every night at the same time and waking up at the same time, because the migraine brain does not like any changes in routine. It likes a very regimented routine. Likewise, long periods of fasting. So even the time period from dinner time, if you eat around 5 or 6 till the next morning, can be a 12-hour time period. Sometimes that can be too long. And that long period of fasting can sometimes generate a headache. So what we tell people is to eat small, frequent, healthy meals and a healthy snack at night, and that may actually help reduce the frequency of migraine. Keeping yourself hydrated is also very important. And you should be drinking 8-ounce glasses of water per day. I think most people probably do not drink that level of fluid. And avoiding other things like caffeine. Sometimes you need to decaffeinate yourself. Sometimes I usually tell people I really don't want them to have more than about 1 caffeinated beverage per day. But if I have people with aura, in my experience, what I found is that it might help to completely decaffeinate them, but the full effects of being off caffeine may not be manifest for at least 3 months of being off it. So if you're someone that's going to be off it for 3 days and then go back on it, then it's probably not going to do much. But you have to realize too that none of these things are going to make a mega change in your headaches, but each one might improve things by like 10 or 15%. But if you get 4, 5, 6 things that are improving your migraines by 10 or 15%, then all of a sudden you got a major change.
Right.
So, so you really have to, try to be part of the solution.
Right. I always say that each thing is like a brick in the brick wall you're building against your migraines. And you need each of these things. I mean, not all of them might work for you, but you probably need a lot of bricks, not just one. And I wanted to ask a quick question. Usually the first thing people say when we talk about exercise is exercise makes my migraines worse. So many people with migraine have what we call kinesiophobia. They are afraid of movement, afraid of exercise because they've had experiences where it made them feel worse. What do you say to those people?
Well, I think you have to build up to the exercise. So I think what I would recommend is maybe taking your exercise up to a level, maybe a little bit below which that would trigger a migraine, and doing that for a while, and then maybe increasing it a tiny little bit. So it's almost like running a marathon. You don't go out and run, 26 miles the first time out.
Right.
You have to kind of build exercise up and in gradual increments. And then maybe to start, it's just taking a walk around the block. And then you do that for a week, and then that doesn't trigger a headache. Maybe you work up to 2 blocks. I mean, so it's just a gradual building of exercise in most instances. If people are real sensitive and every little activity triggers a migraine, even at low levels, then that may not be realistic until you get the headaches under control.
Okay. All right. Is there anything else you'd like to add to our discussion of all these remaining great ideas that we had to wrap up in part 3 of our episodes on refractory migraine?
No, I think that if you want to really improve, you have to have a good relationship with your health provider. And it needs to be a two-way street. It can't be a one-way street. So there's things the doctor needs to do, and there's things that the patient needs to do as well. And working together may be the solution to improve migraine care.
All right. Well, thank you. That is great advice. And everyone, thank you so much for joining us, and join us again next week on Heads Up, the weekly podcast of the National Headache Foundation.